Hey everybody, welcome back to the show. We're here today, Cabral Concept, episode number 2545, all about the pros and cons of growth hormone. So you probably heard a lot lately about hormone replacement therapy, also just deemed HRT. And with that, sometimes things such as peptides or growth hormone. We're not going to be talking about peptides specifically today, but we're going to be talking about a peptide hormone called growth hormone. It's sometimes called IGF-1, sometimes called somatotropin, sometimes called HGH, which is human growth hormone, really all talking about the same thing. I will break down what each one of those things mean, and I'm going to give you from an unbiased perspective the benefits of growth hormone, but also what to watch out for as well. Because like everything in life, there is no one-size-fits-all approach. A lot of clinics are popping up literally in every state, all major cities, pretty much all around the US and Europe as well. And they're promoting this as a rejuvenation-based drug. But I'll tell you, and I hope that you understand this, by the end of the show, you'll know the unbiased perspective of if that's actually true or not, right? Because there's a big difference between how you look and feel, between actually the internal structures of the body. So again, a lot of pros, definitely some cons. Let's go through it, and I will let you, who is responsible for your own health, and you get to make your own decisions, to actually make that decision for yourself at the end. So growth hormone is produced from a gland inside of the brain called the pituitary gland, and it secretes growth hormone, its largest amount typically when you are rejuvenating, recovering overnight, and that's during your sleep. So that's why we want to be able to get that deep rejuvenating sleep at night, because that is what allows us to also produce and secrete our own growth hormone naturally. Now, almost always, we are producing the right amount of growth hormone that we need in order to grow our bodies and repair. And I'll go through all the different amazing things that growth hormone does, but sometimes the pituitary gland does not secrete enough growth hormone, and in those cases, there's typically limited growth, smaller growth stature in both height, weight, bones, muscles, etc. In children, and that may need to be supplemented with before typically the age of 10 to 12, before they hit their growth spurt, because it's not going to do good once the bone growth plates have been closed. And then there are some people who secrete too much, and I think that that's just as much of an issue to worry about as well. That's called acromegaly, and that is essentially from too much growth hormone secretion, the body can grow and become too large, and that includes the organs as well. All right, so now when we're talking about this thing called growth hormone, your body produces it naturally, but also some people supplement with it in terms of an injection. So basically hormone replacement therapy. There are no real growth hormone. I did a whole podcast on natural things that boost your own growth hormone. I will link that up for you. That's what we do in our practice, is boost growth hormone naturally. And I give you all the free ways to do it. That is at stephencabral.com/2545. We're just going to link everything up there today. That's the podcast show notes. And I'll be sure to link up all the research and all the notes there. That's episode 20. Today's episode 2545. 3 big takeaways will be there too. So this is a hormone. It's a peptide hormone, and it's called growth hormone, but it's also called human growth hormone. That's exactly the same thing, because it could be referred to as bovine growth hormone, like that of bovine or cows or some other type of animal, right? So HGH is just the human growth hormone, same thing as GH, which is growth hormone. Both of those things can produce something called IGF-1, right? So insulin growth factor 1, and that is what helps the body to grow and rejuvenate and basically cell regeneration and cell reproduction. Those are some positive things. So we definitely need some growth hormone at all ages. I also have a chart if you want to check out to see if you're at the right production of growth hormone for your age, because it declines after essentially adolescence and 20s. So I'll link up that chart and with the podcast again at 2545. So you can actually, if you ever run your own levels, you can actually see if you're at the right level or not. I will also link up an IGF-1 test. That's the only test that you can do at home to actually see if your body's secreting enough growth hormone, which would then induce IGF-1. So that's kind of a roundabout kind of way to see if you're producing enough IGF-1. All right, so that's that. There is one more word that you may see for growth hormone, and that is somatotropin. And this is typically the recombinant form of human growth hormone that's synthesized and used as a drug. So people may get injectable, or animals may get injectable somatotropin for growth hormone. All right. So now that we know what it is, how does HGH work, or how does growth hormone work? Well, it increases calcium retention in the body. That can be not necessarily a bad thing, because it can remineralize and strengthen bones, teeth, nails, so any type of tissues of the body. So that can be a positive, but of course it can be a negative in terms of cardiovascular issues, hardening of the arteries, etc. But I'll go through the pros and cons in just a minute. It can increase hypertrophy. It promotes the breaking down of fats. It increases protein synthesis. I'll explain again these in a moment for pros and cons. Stimulates growth of all organs of the body except one, the brain. So that's interesting, right? So it can make your liver grow, your spleen grow, your heart grow, make everything grow in the body except the brain. I found that very, very interesting. It can block or stop the uptake of glucose to a degree, right? Like, it's not going to stop you being able to use glucose, but it is actually promoting the breakdown and utilization of amino acids and fatty acids for fuel. So it can actually help with fat loss in that way. But the problem is then the glucose actually stays in your blood longer, raising blood sugar levels for some. It can stimulate the immune system in a positive way, potentially overstimulate if too much is used, but that can be a benefit as well. And it can also improve, in some, not all, the deiodination of T4 to T3, and potentially helping with conversion of active thyroid hormone, if not too congested in the liver, where a lot of that is taking place. Okay, so those are a lot of the actions of growth hormone. So what I did was I just narrowed it down to about 5 or 6 pros and about 5 or 6 cons, and then we'll wrap the whole thing up at the end to see maybe in your 60s and beyond if it's the right thing for you. And I said 60s and beyond, that's a key word here. We'll talk about that in just a moment. All right, so here are the pros. It can help growth that has been stunted as a child. So again, this is important because it may be needed for some children that are not producing the right amount of growth hormone in order to stimulate the growth of bones, muscles, organs, etc., where they might be off the growth chart. Now, again, if your child's on the growth chart, they're just on the lower end, well, they just may be a smaller individual, right? It's always a parent's choice, of course, but if they're far below that, then you may look into it. May, not all, because again, I don't know that it's necessary, right? I don't know that it's necessary, but what I will share with you is this, is that for some children, health-wise and confidence-wise and all that, they may want to boost. But I don't know that it actually improves overall health and longevity, and the opposite may be true, and I'll share that in just a moment as well. All right, the second is that it does rejuvenate tissues of the body. So it rejuvenates cells. I mean, that's a big part of it. So cell rejuvenation and regeneration absolutely can help with youthfulness of the body. There's just no doubt about that. It can help with the overall look and structure of the body in terms of the toneness, tautness of the skin, thickening of the skin, all of those things. Water retention, it all matters. It can improve your muscles, your endurance with workouts, or your strength with workouts. And I don't know that it's necessarily conversely, but it does boost the metabolism as well. So one of the reasons why it boosts the metabolism outside of exercise, even of itself, is that it boosts protein synthesis, as you heard me say that before. So if you boost protein synthesis, even without working out, you can actually gain muscle mass. So they've shown this with anabolic steroids, with testosterone above a normal level. But if you add growth hormone to the mix and you exercise, you're going to increase protein synthesis, which just helps for greater muscle repair. So if you're breaking down muscle tissue and you're doing things to increase the hermetic stress on it, meaning the amount that you can lift, right, with weights, and you continue to progressively overload that or stimulate the breakdown of those tissues, you can increase what's called the actual, it's called sarcomere hypertrophy. You'll be able to grow those muscles larger, all right? So that's and again, I think most people kind of think of that when you grow larger, like with cows, right? Why do they give cows growth hormone? Well, if they can produce larger cows, they can sell that cow for more money because they sell it based on the actual poundage of the meat, okay? So that's that. Helps strengthen bones. There are people, I know MMA fighters, I know professional athletes that outside of testing have used growth hormone or in special circumstances be given the ability to use growth hormone in order to repair a broken bone or even a severe cut. And the reason they did this is because the bone may not have complete severing of a bone, a femur, tibia, fibula, humerus. Like if these bones snap in half, they may not take. And if they don't take, typically an amputation does need to take place. So there are specific circumstances in that it could be very, very beneficial for a short period of time, like very beneficial, and you'll talk with your doctor about that. Okay, it helps decrease body fat, and the reason is that we talked about before, if we are preferentially using amino acids and lipolysis, the breakdown of fats for fuel, well, we're gonna break down more fat, right? So we're gonna actually burn more body fat. And the last part is that there still needs to be more research on this, but it may improve cognitive function. So nice little benefit there as we begin to age. All right, so we talked about the stimulation of IGF-1. Again, that's a lab that you can actually test for to check your own levels. And the production of IGF-1 is what I spoke about before, of the increase in glucose and the free fatty acids, basically, of the amino acids, free fatty acids, in order to break those down as fuel, and then unfortunately leaving some of that blood sugar to be elevated. So not in all people, but one of the cons, so we'll get into the negatives now, can be diabetes. So it is possible to actually develop type 2 diabetes by taking growth hormone, typically above a natural level that you would get with age. So why don't I state this at the very end, what age I think is probably most appropriate, and I think that we should take a look at this. But also, an increase in growth hormone can increase the organs and specifically affect the heart. So if the heart continues to grow in size, that can be quite detrimental for things like heart disease, potentially even stenosis of the arteries, hardening of the arteries, atherosclerosis, simply because calcium is kept in the bloodstream longer. And if calcium is kept in the bloodstream longer, regardless of cholesterol, that if there is inflammation, if there is issues with the arteries, that calcium can actually begin to bind and stick in the arteries, causing a hardening of the artery. So that's really important to look at that as well, because that can be outside of cholesterol. So really important to look at that. And so if you increase cortisol, you increase calcium, you have high levels of inflammation, that can be a real recipe for disaster for heart disease and heart attacks. And it's often why you see a lot of bodybuilders die well below 60 years old, right? Well below 60 years old. So from really abuse of growth hormone, abuse of typically testosterone as well. All right, there can be erectile dysfunction in men, but there can be lower libido in both men and women. Again, this doesn't affect everyone, and I'm not saying that it does, just like the benefits don't always have the huge degree in all people. But, how does it work? Well, again, if you're quite deficient in growth hormone and you take it, you feel a really big boost. If you're already doing really well in growth hormone and you take more, well, you may not get as much of a boost, and you may actually start to get more of these cons, right? Like it's always about creating dynamic equilibrium in the body. That's the most important thing in life. It's like no such thing as moderation. It's just, do you need it or do you not need it, right? Like that's really what it's about. And if you're very short on it and you need more of it, then it's helpful. But if you already have enough and you take more, then it's detrimental. Like it's like that for literally everything in life, like everything from intermittent fasting to cold plunges to sleep to whatever, right? Above 9 hours of sleep, not healthy for most people. Below 7 hours a night, not healthy for most people. 7 to 9 hours, yeah, that's about the sweet spot for most people, but it's like, okay, well, what do you need? A little bit more, a little bit less? Again, that's based on bio-individuality. Okay, so the fourth one is blood clots. Not ideal, right? And it's not just at the injection site. Blood clots, to a degree, can be increased in those that use growth hormone. There can be an enlargement of not just the muscles and bones. I talked about the organs before, but also the face can become more round and larger. the hands and feet can also grow. There's a famous case, so I'm not talking out of turn here, by any means. I don't like to, I would never. There was a recent example on YouTube and podcasts of a well-known podcast host kind of outing someone that was using testosterone and growth hormone, et cetera. I don't think that's the place for any practitioner to ever do that to a client of yours or someone else without their permission. I just don't see that as very good for our field in terms of ethics, but that's just me. I mean, that's opinion. So anyway, there was a baseball player a bunch of years back called Barry Bonds. And I only say this as an example, that when you look at Barry Bonds, you can just type in Barry Bonds at 21 years old, 23 years old, whatever you want to do. And then Barry Bonds at 40 years old playing baseball. His head is much, much larger. Hands are much larger. And his foot size, I believe, grew from a 9 or 10 to a 13. Like it was just, and you don't keep growing as a 30-year-old, 40-year-old male. Like that's just not the way that the human body works. You could continue to grow as an early 20s male. That's not uncommon. I shouldn't say that. It's rare, but possible, but certainly not at that age. And obviously, he was caught using anabolic steroids and growth hormone, and you just the look of the individual can change. So if you ever want to see a before and after, it doesn't mean that he looked better before and after. I'm not saying that at all. It's just it can absolutely grow your face, your head, literally the bone structure and tissues, your hands and feet. Okay, so that's that. And the sixth one is this: if you do have cancerous cells in your body, if you do have a tumor, it can grow that as well. So again, growth hormone creates cell regeneration, cell proliferation as well. So the proliferation can actually grow cancerous cells. So we have to be careful of that, right? So if you ever use growth hormone, I highly recommend actually doing a cancer screening, a cancer test. So there's the full body scan. I'll be talking more about that on the podcast coming up. I'll certainly be talking about that a lot more with my HPH program. But the other thing that I wanted to share with you is that you can run a blood test now that will actually look for, I believe it's protein secreted by certain cancerous-based tumors before they're even large enough to be picked up. So I find this new technology very, very interesting and fascinating, and I think that it's worth looking into. So I don't think that I've reviewed that yet. Maybe I'll even review it on this Friday's podcast. So we'll call that the cancer screening test. We'll put that in there. Okay. All right. And so those are the pros, those are the cons. We just went through that. I think that, again, that was fairly unbiased, all the benefits and then all the potential negatives. I will tell you this, when we look at longevity, there does not seem to be any good data that shows that people live longer by supplementing growth hormone. It actually seems to be the contrary. People who live the longest seem to have lower levels of IGF-1 concentration, and growth hormone helps to, again, induce IGF-1. So when we're looking at that, we have to weigh what's called reproductive health versus longevity. So what this means basically is if you take growth hormone, you will most likely look younger. You will, honestly, you'll probably feel a little bit better. There's no doubt about that as you begin to age, but it may come as a sacrifice of length of life. So that's for people to weigh on their own. It really is. But to me, it looks like from the data, over 50 years old, when you start supplementing with growth hormone, the potential for cancer becomes greater, okay? The other part is this, is that women seem to fare worse with it in terms of longevity than men. And that's interesting as well. So in general, I will state this, the larger your body becomes, the lower the likelihood for living a very long life. Now, normal life, yes, right? Early 70s, mid 70s. A long life, 85 to 100 years old, most likely not. And so it's just something, again, to take into consideration. I take these things into consideration for my own self, for my own parents, for my family. And I can't recommend using growth hormone really at this time. Now, Could I get behind someone in their mid-60s doing low levels of growth hormone just to bring them up to what might be like a baseline at, let's say, a certain age, maybe like 40s or something like that? Maybe, but we just have to then be running the lab tests like the cancer screenings, the blood clots, the glucose levels, the heart disease checks, like all those things. So what I'm saying is this: if you're feeling well and you're optimizing your health and you're doing well, I don't recommend supplementing hormones. I really can't. Because if you don't need them and you're doing well, then there's not a lot more benefit you can get, but there are potential downsides. So I just want people to understand the pros and cons and the risks, and then to make the best educated decision you can for yourself, for your family as well. Because again, this does affect your family if you potentially get heart disease, heart attack, diabetes, cancer, etc. So again, weigh the pros and the cons. If it's right for you, I know you'll make the best decision. So hopefully this was helpful. Of course, please do pass this along to anyone else you believe it could serve. And for all of today's updates, as well as previous podcasts on growth hormone, IGF-1, the charts, etc., head on over to stephencabral.com/2545. Take care, everybody.